you considering surgery for your rotator cuff muscle tear? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to talk about some facts about surgery for rotator cuff muscle tears. So here at My Favourite Physio, we see quite a few patients with shoulder pain. Every now and then we would see someone with a full thickness tear of their supraspinatus muscle, which sits right on top of here in the groove of the shoulder blade. It is more common in the older adult, although it does happen in younger adults as well. Often in the younger adults, it's because of trauma or repetitive use carrying heavy items all the time as part of their work. In the older adult, it can actually be wear and tear over time and gradually, without doing anything too heavy, perhaps just even lifting a kettle off the kitchen bench can cause that muscle to tear. Every now and then, they're also told that they should perhaps consider surgery. So I thought I would jump in and have a talk about the facts surrounding surgery for a rotator cuff muscle tear. The first thing to know is studies have shown that the success rate for a rotator cuff muscle tear to be repaired surgically can vary anywhere between 34% success rate to 94% success rate. The factors that contribute or influence your success rate from surgery include your age, it includes the work that you do, it includes the fatty tissue infiltration in your muscle belly. It also matters how big that tear is, how long that tear has been there, how much muscle wasting has happened, how much retraction of the tendons in that muscle has happened to determine if it's going to be successful. Then there's the surgical methods that could affect or influence the success of that surgery. So generally, if you're older than 60, your rates of success is reduced. If there's more fatty tissue and muscle wasting, then it is less likely to be successful. If you work in a heavy manual job, then even though you have a repair, it is more likely to re-tear. So given that those are the facts, it's important to consider, is surgery the best option for you? The main purpose of surgery often is for pain relief and to increase function. Now, studies have actually shown physiotherapy for adults at 60 and above with a rotator cuff muscle tear actually can give you 94% success rate, where the person actually no longer feels pain and is able to regain movement in their arm to be functional. So if you're at that age group of 60 and above, it is perhaps better to consider having a conservative approach to your rotator cuff muscle tear. Physiotherapy has been proven to help patients overcome their shoulder pain when there is a rotator cuff muscle tear. So if you're out there and you're experiencing shoulder pain, you're unable to lift your arm up easily because you've torn your rotator cuff muscle, particularly the supraspinatus muscle that sits up on top, why don't you ring us here at My Favorite Physio, speak to one of our expert physiotherapists, find out what we can do to help you overcome your shoulder pain without surgery. The number to ring is 02-9790-4233. And if you know somebody out there in your world who has been putting up with shoulder pain, why don't you like and share this video with them? Until next time, have a fantastic day. Bye.